Hi everyone, welcome back. This is a table which is really just to give us a visual about the BMI and which is the body mass index, and the waist to hip ratio, which is commonly what we use to determine the need for weight management, and what we use to determine what is healthy weight and what is unhealthy. So body mass index, or BMI, is calculated by taking your weight in kilograms and dividing that by your height in meters squared. So we have an online calculator that you can use to plug in your numbers, your weight and your height, and it will give you a figure which is your BMI. And we have several categories of BMI, and it can be any number. As you can imagine, it just depends on the numbers that we are working with here. So a BMI of less than 18.5 is considered underweight. That category of weight, whatever gives you 18.5, you will be considered underweight. This is not a healthy category, because this one puts one at risk of some health complications, health issues, commonly nutritional deficiencies, low immunity. People tend to get sick often. So this is not a category that we want to be at. Then the healthy BMI is 18.5 to 24.9, and as you can tell, it's a range. So really you have a wide range to work with to determine where your weight can be. What I recommend is to be somewhere in between. So if you are somewhere in between, then you have room to go up and down. Okay, so it's not a fixed number. At the same time, anything above 25, we start using the terms overweight and all that. 25 to 29.9 is considered overweight. Above 30, we start utilizing the term obesity. So anything between 30 to 34.9, that is considered obesity class 1. At 35 to 39.9 is considered obesity class 2. And anything above 40 is considered obesity class 3, also known as morbid obesity. So the higher the BMI, the higher the health problems that are expected to come from lifestyle, especially lifestyle diseases like diabetes, metabolic syndrome, insulin resistance, which really is what leads to diabetes. Things like heart disease, sleep apnea is very common too, joint problems, back pain. Even the quality of lifestyle is not so good because your mobility may be compromised, and if you're getting sick, if this predisposes you to health problems, and so if you're getting sick so often, of course this is not something that you want. You want a better quality of life. You don't want to be dealing with illness all the time. So there is motivation to work to lowering your BMI and bring it as close to the healthy level as possible, and it is doable. It is possible. It may not take a day or a month or a year. It just takes consistency of working with a program that can help you lower that weight so that it lowers your BMI. Remember, the height is constant, so actually we're just talking about weight. We're not going to manage that in any way. This is the only variable that we can work with to try and come back to the healthy level. So take your time and start a program that you can do in the long run. You can keep with it and build on it, and finally work towards approaching the normal BMI, which is 18.5 to 24.9. So on the other side of the table, we have the waist to hip ratio, or the WHR, which is calculated by taking the measurement at your waist divided by the measurement at your hip. So here we deal with the narrowest part of your waist, which is normally just above your belly button, and the widest part of your hip. So use a tape measure and fit it just snugly around your waist, not tightly, and let it not be lopsided. Let it be a uniform line, like parallel to the floor, and get those measurements, and then go ahead and calculate, and you'll get your waist to hip ratio. So it's preferable to have, for males, to have a waist to hip ratio of less than 0.9, and for females a waist to hip ratio of less than 0.8 is preferable, because at this level, at this category, your risk of health problems or from lifestyle diseases is very low. So this is where we're preferring, or we want to be. Our goal is to be at this point. Then, if your waist to hip ratio starts getting high, if you are a man and it's 0.9 to 0.99, or for females, if it's 0.8 to 0.89, it puts you at a moderate risk for lifestyle diseases. So So that is that category. And then the higher it gets, the higher the risk. So if you're a man and you find yourself having a waist to hip ratio of above 1, and if you're a female and you find that your waist to hip ratio is more than 0.9, then your risk for, health problems becomes very high. So the reasoning behind this is that if you have a high waist to hip ratio, it means that your waist is big. You have fat deposition in your abdomen. It's called central obesity. And this means that you have a lot of visceral fat surrounding the organs in your abdomen, and it has been shown to correlate with heart disease, diabetes, metabolic syndrome, all those things that we talked about. So that is why this is something that we focus on. So if you realize that you are anywhere between, in this category, moderate or high risk, or anywhere above with a BMI of 25, then that should give you some motivation to work on reducing the weight. Again, when you reduce your weight, you burn fat. You're burning this fat, your waist reduces. We all know that when people lose weight, they talk about, you lose some inches around the waist. So this is something that we can work on. And as your weight comes down, of course, you're burning fat, like for the program that we will be talking about, or we're working on, you burn fat, you reduce that waist circumference, and your waist to hip ratio goes down. So there you have it. So these are the goals. So the goal for our weight management is to come to this category of low risk for the waist to hip ratio, and this category of the healthy BMI. So this is what we are working for. So whatever you're doing, when you assess your weight or you assess your progress, remember you're looking towards you want to have a low risk for lifestyle related diseases, and you want to have a healthy BMI so that you as well can reduce that risk. So thank you for watching. I'll see you in the next video.